It's common for men over 40 to experience changes in their sex drive, and this video aims to provide information and solutions. Libido is defined as sexual desire or interest in sexual activity, and what's considered normal varies greatly from person to person. A problem arises when a decreased libido causes distress or relationship issues, and we'll cover common causes and practical steps to address this. Testosterone levels naturally decline with age, typically around 1% per year after age 30 or 40. This decline can lead to decreased libido, fatigue, and loss of muscle mass, though a normal range is typically between 270 to 1070 nanograms per deciliter. Some men experience a more significant drop, a gradual process sometimes referred to as andropause, unlike the more abrupt menopause in women. Chronic illnesses like heart disease, diabetes, obesity, and high blood pressure can significantly impact libido and erectile function. These conditions can affect energy levels, self-image, and crucial blood flow, all vital for sexual health. Certain medications, including antidepressants, blood pressure medications, opioids, and chemotherapy drugs, can also lower testosterone levels or affect sexual function. It's crucial not to stop taking any medication without first consulting your doctor. High stress levels increase cortisol, a hormone that can interfere with testosterone production and directly decrease libido. For men over 40, common stressors include career pressures, financial worries, and significant family responsibilities. Depression and anxiety can directly reduce libido and impact sexual function, and some medications for these conditions can also have a negative effect. Low self-esteem and body image issues can lead to anxiety about sexual performance, further contributing to reduced desire. A diet high in processed foods, saturated fats, and sugar can contribute to weight gain and lower testosterone levels. Both too little and too much exercise can negatively impact libido, as insufficient exercise contributes to health problems affecting sexual desire. Excessive alcohol consumption can reduce testosterone levels and increase the risk of erectile dysfunction, while illicit drug use has significant long-term negative effects. Sleep disorders like sleep apnea and insomnia are strongly associated with decreased libido and erectile dysfunction. Relationship issues such as a lack of emotional connection, poor communication, and unresolved conflicts can all contribute to lower libido. Excessive pornography use can lead to unrealistic expectations, body image issues, and a pseudo-low libido where interest is only in an unhealthy way. The first crucial step is a medical evaluation. Consult a doctor or urologist to assess hormone levels and identify underlying health conditions. Testosterone replacement therapy, or TRT, may be an option for men with clinically low testosterone levels. Discuss the potential benefits and risks with your doctor, as TRT should always be medically supervised. Embrace lifestyle changes, starting with a healthy diet rich in fruits, vegetables, lean protein, and whole grains. Regular exercise, including aerobic activity and strength training, can improve stamina, body image, mood, and testosterone levels. Manage stress through techniques like meditation, yoga, deep breathing exercises, or engaging in hobbies. Prioritize adequate sleep by practicing good sleep hygiene and maintaining a consistent sleep schedule. Quit smoking and limit alcohol consumption, as both have significant negative effects on sexual health. Open communication with your partner about sexual needs and concerns is vital for a healthy relationship. Prioritize quality time together, plan date nights, and focus on emotional connection to strengthen intimacy. Consider couples therapy or sex therapy to address relationship issues and improve communication. Some supplements like maca, ginseng, fenugreek, L-arginine, and tribulus may help boost libido. Always consult a healthcare professional before taking any supplements, especially if you have existing health conditions or are on other medications. If erectile dysfunction is a contributing factor, various treatments are available, including medications, lifestyle changes, and in some cases, penile implants. Remember, low libido in men over 40 is often multifactorial and, importantly, treatable. Take proactive steps by consulting healthcare professionals and making positive lifestyle changes to address any concerns about your sexual health. A fulfilling sex life is possible at any age with the right approach and support. Welcome back to our series on why men lose interest in sex and what helps. In Part 1, we discussed general factors influencing libido, and now in Part 2, we'll dive deeper into specific causes like hormonal changes and practical solutions tailored for men over 40. For men over 40, a significant reason for decreased sex drive is often hormonal changes, primarily a natural decline in testosterone levels that begins to accelerate around this age. Testosterone, the primary male sex hormone, is crucial for regulating sexual function, maintaining muscle mass, supporting bone density, and ensuring proper red blood cell production, all of which contribute to overall vitality. After the age of 40, testosterone levels typically decrease by 1 to 2% each year, a gradual but consistent decline that accumulates over time and can lead to various noticeable symptoms in daily life. These symptoms include decreased sexual desire, challenges with erectile dysfunction, persistent fatigue that affects energy levels, reduced muscle mass leading to weakness, and an increase in body fat around the midsection. However, it's important to remember that not all men with age-related low testosterone will experience noticeable symptoms, as individual responses to hormonal changes can vary widely based on genetics and lifestyle. Beyond hormonal shifts, various physical factors can also contribute to a decreased interest in sex, impacting both the body and the mind in subtle yet significant ways. Chronic illnesses such as diabetes, which affects blood sugar, heart disease that strains circulation, high blood pressure leading to vascular issues, high cholesterol clogging arteries, and sleep apnea disrupting rest can all play a role in reducing libido. Certain medications, including antidepressants that alter brain chemistry, blood pressure medications which can cause fatigue, and chemotherapy drugs used in cancer treatment, are also known to impact libido by interfering with hormonal or neurological functions. Lifestyle factors like excessive alcohol consumption that impairs liver function and hormone production, smoking which damages blood vessels, and drug use that disrupts brain signaling can significantly diminish sexual interest over time. Psychological factors are equally important, with relationship problems such as unresolved conflicts or emotional distance often leading to a decline in intimacy and desire within partnerships. Stress from work or life pressures, anxiety that heightens nervousness, depression causing emotional numbness, and low self-esteem eroding confidence are mental health issues that can profoundly affect a man's sex drive and overall well-being. Fortunately, there are several strategies and lifestyle changes men over 40 can implement to combat decreased sexual interest, helping to restore balance and enhance their quality of life. A balanced diet rich in antioxidants from fruits and vegetables and essential nutrients like zinc and vitamin D is fundamental for overall health, supporting hormone production and reducing oxidative stress on the body. Regular exercise, aiming for at least 2.5 hours of moderate intensity activity per week such as walking or cycling, can significantly boost well-being by improving circulation, mood, and testosterone levels naturally. Stress management techniques like mindfulness practices to stay present, meditation for mental clarity, and deep breathing exercises to calm the nervous system can help alleviate psychological pressures that dampen desire. Prioritizing quality sleep, ensuring 7 to 9 hours per night in a dark and quiet environment, is vital for hormonal balance, restoring energy levels, and preventing fatigue that affects libido. Quitting smoking to improve blood flow and limiting alcohol consumption to moderate levels, perhaps 1 drink per day, are crucial steps for improving sexual health and overall vitality in the long term. Certain foods can also help boost testosterone, including fatty fish like salmon rich in omega-3s, oysters and shellfish high in zinc, and eggs providing cholesterol needed for hormone synthesis. Leafy green vegetables such as spinach for magnesium, cocoa products like dark chocolate for flavonols, berries and cherries packed with antioxidants, pomegranates for blood flow support. Garlic and onions for allicin benefits are also beneficial for hormonal health. Improving mental and emotional well-being involves open communication with a partner about needs and feelings and seeking counseling for relationship dynamics or mental health issues to foster deeper connections. Medical interventions may include testosterone replacement therapy, or TRT, through gels, injections, or patches if low testosterone is confirmed as the primary caused by blood tests. Additionally, a medication review with a doctor can identify if certain drugs like beta blockers or SSRIs are contributing to a low sex drive, allowing for potential adjustments or alternatives to restore function. By proactively addressing these physical factors like hormones and illnesses, psychological elements such as stress and depression, and lifestyle factors including diet and exercise, men over 40 can regain their sexual interest and vitality. Consulting with healthcare professionals, including primary care doctors for checkups, therapists for emotional support, and sexual health specialists for targeted advice, provides personalized guidance and support tailored to individual needs. For men over 40, a decline in sexual desire is a common and often complex experience, rooted in various interconnected factors encompassing physical, psychological, and lifestyle elements. This video explores the multifaceted reasons behind decreased libido, delving into common challenges and offering practical, holistic strategies to effectively reignite sexual desire and function. One significant factor is the natural physiological process of hormonal adjustments that occur with aging, particularly the gradual decline in testosterone levels, a key hormone vital for male sexual health. Testosterone, vital for libido, muscle mass, bone density, and energy, typically begins to decrease by 1 to 2% per year around age 40, a natural yet impactful shift in male physiology. This gradual reduction in testosterone can lead to a noticeably reduced sex drive, persistent fatigue, decreased muscle mass, an increase in body fat, and even mood changes. While most men maintain testosterone levels within the normal range, a significant portion experiences clinically low levels, leading to late-onset hypogonadism, which often requires medical evaluation. Physical health issues also significantly contribute to decreased libido and sexual function, with erectile dysfunction, or ED, becoming increasingly prevalent with age, affecting intimacy. ED can be caused by underlying conditions like heart disease, diabetes, high blood pressure, high cholesterol, and atherosclerosis, which impair the crucial blood flow essential for erections. Chronic diseases such as obesity, arthritis, and heart disease can profoundly impact sexual function, primarily due to the associated chronic pain, persistent fatigue, and reduced mobility. Furthermore, certain medications prescribed for high blood pressure, heart conditions, anxiety, and depression can also contribute to ED by affecting hormones, nerve signals, or blood flow. Lifestyle factors play a crucial role in sexual health, with habits like smoking, excessive alcohol consumption, and a lack of regular physical exercise significantly hindering libido. Poor dietary habits, characterized by processed foods and a lack of essential nutrients, also negatively impact sexual health, affecting overall well-being, energy levels, and hormonal balance. Psychological and emotional well-being are intrinsically linked to sexual function, as chronic stress, pervasive anxiety, and clinical depression can significantly lower libido and diminish interest. Chronic stress can lead to erectile dysfunction by impacting hormone regulation and blood flow, and it also significantly diminishes the mental energy required for sexual thoughts and fantasies. Anxiety disorders and performance anxiety can create profound feelings of inadequacy, self-doubt, and fear of failure, further contributing to ED and creating a challenging cycle. Depression can profoundly diminish libido and overall interest in sex, affecting not only the physical act, but also the emotional intimacy, connection, and joy experienced within relationships. Relationship problems, including a lack of open communication, unresolved conflicts, and general dissatisfaction, can also significantly impact sexual desire, leading to emotional distance. Low self-esteem and a negative body image can lead to deep-seated insecurities about sexual performance and overall confidence, creating significant psychological barriers to intimacy. Strategies for reigniting sexual desire and function require a comprehensive, holistic approach, starting with fundamental lifestyle modifications that address the root causes of decline. A healthy diet rich in antioxidants, regular exercise to boost circulation and mood, and effective stress management techniques like mindfulness are key pillars for improving sexual health. Adequate sleep, completely quitting smoking, and significantly limiting alcohol consumption are also vital steps for improving sexual health, boosting energy, and enhancing overall well-being. Medical interventions may include testosterone replacement therapy, or TRT, for men with clinically diagnosed low testosterone, which can help restore hormone balance, improve libido, and energy. Medications for ED, such as PDE5 inhibitors, can also be prescribed to improve erectile function, alongside diligently treating any underlying chronic conditions like diabetes or heart disease. Psychological support through therapy and counseling can effectively address underlying depression, anxiety, and performance anxiety, helping men regain confidence and emotional well-being. Open and honest communication with partners is absolutely crucial for resolving any relationship problems, rebuilding trust, and fostering deeper emotional and physical intimacy. Key considerations include adopting an individualized approach, recognizing that each man's situation is unique, and consulting with qualified healthcare professionals for proper diagnosis and personalized management. Ultimately, focusing on overall well-being, encompassing all physical, mental, and emotional aspects of health, is paramount, as these elements are deeply interconnected and influence sexual vitality. By proactively addressing these multifaceted factors and diligently implementing appropriate strategies, men over 40 can indeed maintain a fulfilling, active, and satisfying sex life. Remember, adopting a proactive and holistic approach to sexual health, addressing all contributing physical, mental, and emotional factors, can significantly improve your overall quality of life and intimacy.
As men age, particularly after 40, changes in sexual desire are a normal and common experience. However, maintaining a fulfilling sex life remains crucial for intimacy, stress management, and overall well-being. This video aims to explore the various reasons behind declining libido in men over 40 and provide actionable steps to address these concerns. One significant factor is hormonal changes, specifically the gradual decline in testosterone levels, often referred to as andropause. This decline typically begins around age 40, with testosterone decreasing by about 1 to 2% per year. Lower testosterone can impact libido, erectile function, muscle mass, energy levels, and mood, though it's rarely the sole cause. Several medical conditions can also affect sexual interest and function. Cardiovascular disease, high blood pressure, and high cholesterol can reduce blood flow to the penis, leading to erectile dysfunction and decreased desire. Diabetes, obesity, chronic kidney disease, sleep apnea, and thyroid disorders are other common culprits that can significantly impact libido and testosterone levels. Furthermore, certain medications can have a side effect of lowering libido. These include antidepressants, blood pressure medications like beta blockers, opioid pain relievers, chemotherapy drugs, and antipsychotics. Beyond physical health, psychological factors play a crucial role in sexual desire. Chronic stress, for instance, elevates cortisol levels, which can inhibit testosterone production and decrease libido. Stress can also constrict blood vessels, impacting erectile function, and is often linked to workplace pressures, financial worries, and family responsibilities. Depression is another significant factor, often leading to a general loss of interest in activities, including sex, due to chemical changes in the brain and lack of motivation. Relationship issues, such as a lack of intimacy, poor communication, or unresolved conflicts, can also significantly diminish sexual desire. Performance anxiety and low self-esteem, stemming from a fear of not meeting expectations, can prevent sexual arousal and exacerbate dysfunction. Past trauma or negative sexual experiences can also contribute to low libido, requiring sensitive consideration. Lifestyle choices also profoundly influence sexual health. A diet high in processed foods, saturated fats, and sugar can lead to weight gain and decreased testosterone levels. Instead, a balanced diet rich in fruits, vegetables, lean proteins, whole grains, and healthy fats is recommended. Specific foods like oysters, fatty fish, eggs, leafy greens, and nuts can even help boost testosterone. Regular exercise, especially strength training, can increase testosterone and improve blood flow, but be mindful not to overexercise. Insufficient sleep negatively impacts hormone levels and overall well being, so establishing a consistent sleep routine is vital. Excessive alcohol consumption and illicit drug use can worsen erectile function and reduce testosterone, while smoking can suppress testosterone and increase the risk of erectile dysfunction. Addressing these concerns begins with a medical evaluation. Consult a healthcare professional to discuss your concerns and undergo a comprehensive evaluation, including blood tests for hormone levels and underlying medical conditions. Testosterone replacement therapy, or TRT, is an option for men with diagnosed hypogonadism. TRT can improve libido, sexual function, energy, muscle mass, and bone density, but it also carries potential risks like prostate issues and blood clots. It's not suitable for all men and requires careful monitoring by a healthcare provider. Reiterating the importance of lifestyle changes, focus on diet, exercise, sleep, and stress management. Reducing alcohol consumption and quitting smoking are also crucial steps. Psychological support, such as counseling or therapy, can address stress, anxiety, depression, and relationship issues. Couples therapy can also significantly improve communication and intimacy within a relationship. In conclusion, low libido is a common issue with many treatable causes. Taking proactive steps to address your concerns can significantly improve your sexual health and overall well-being. Remember, seeking help is a sign of strength and self-care, leading to a more fulfilling life.